It's no secret that the current administration is not a fan of the Affordable Care Act and has pushed measures to strike it down. However, swiping health insurance out from under the feet of millions of Americans who now depend on it is not a terribly popular option. We've heard a lot of promises of a replacement option, but nothing has materialized over the last I don't know how many years. Recently, however, an executive order on healthcare was issued. The problem is that this order changes nothing. And the bigger problem is that a lot of people probably don't know that. That's the topic of this week's Healthcare Triage. On September 24th, the president signed an executive order on an America First healthcare plan.
Today, I will lay out my vision for a healthcare system that puts patients first, families first, and perhaps most importantly for all of us, America first.
Nicholas Bagley, a law professor at the University of Michigan and a contributor to our blog, is concerned that it will be used to confuse the American public right before the election. Both healthcare and the law are complicated matters, and issuing this order can easily lead people to believe that something is being done about their major healthcare concerns. We've tapped into Nick's writing on the matter to help people understand what's really going on. The order has 5 sections, with the first section being the longest. It uses most of its real estate to talk about what the administration has done to improve healthcare, and the rest of it to air grievances about the Affordable Care Act. Alongside this, Section 1 states that people with pre-existing conditions should continue to have access to health insurance even if the ACA is dismantled, but it fails to mention how that will happen. This is important because if we want to keep this protection, there must be a legal path to do so if the ACA is no longer around to provide it. No such path is provided by this order. Section 2 consists of one sentence, simply stating that it has been and will continue to be United States policy to provide choice, low cost, better care, and coverage for pre-existing conditions. It's worth mentioning here that the types of policy supported by the current administration support the removal of protections for pre-existing conditions. So that means if policy does in fact continue to be as it has been, the outlook would not actually be great for anyone relying on these protections. Section 3 is also one sentence. It states that access to and options for affordable healthcare should be expanded. That's it. Not much to say here except that sure, that's fine, but we're wondering not only what the plan is for making that happen, but also where has that plan been all this time? Section 4 is a little longer. It comes with 3 parts, the first of which asks that access to affordable medicines be expanded. Part 2 asks that consumers have access to meaningful information about the price and quality of care before they receive it. This is essentially a directive to put an end to surprise billing, which are large bills from hospitals for out-of-network care that a patient was unaware of and had no role in choosing. The third part of Section 4 is a one-sentence directive to reduce fraud, waste, and abuse in the healthcare system. And finally, Section 5 consists of 2 parts, one directing that quality of care delivery be improved for veterans, and a second asking that medical innovations continue to be promoted in order to find new and better treatments for many of the diseases which ail us. So all of this sounds great, right? Of course we hate overpriced medication and surprise billing. Of course we want choice, reduced waste and fraud, better care for veterans, and more innovation in healthcare. The thing is, writing statements that suggest doing things that we've all been suggesting be done for years doesn't really do anything. And even if this executive order laid out a specific plan for making all these desired outcomes happen, you might be surprised to know that none of it could actually be enforced anyway. Because here's the thing that a lot of people don't seem to know. Most executive orders have no legal effect. As Nick puts it, they're just internal memos with a fancy header. The president's authority to issue an executive order has to come either from the Constitution or from federal law. Put another way, executive orders only hold legal weight if they are issued to exercise authority that has previously been delegated to the president. Since the power to prohibit discrimination against the sick has not been delegated to the president, the executive order on an America First healthcare plan holds no legal authority at all. So there is still no plan and no legal path to stopping surprise billing and unaffordable medications. No plan or legal path to increase choice, reduce waste and fraud, provide better care to veterans, or promote more innovation in healthcare. And perhaps the biggest takeaway is that individuals with pre-existing conditions will still be left completely unprotected if the Supreme Court votes to dismantle the Affordable Care Act, an outcome we should know sometime next spring. In short, the executive order is useless, except maybe as a talking point right before the election. Healthcare is a major issue for voters, and the American public deserve to know exactly what's on the table. Hey, did you enjoy this episode? You might enjoy this previous episode on the Biden-Harris COVID plan. We'd like it if you'd like and subscribe down below, and go on over to patreon.com/healthcaretriage, where you can help support the show even during this global pandemic. We'd like to especially thank our research associates, James Glasgow, Joe Sevitz, Josh Gister, and Michael Chin, and of course, our Surgeon Admiral Sam.